Hello, everyone. Welcome back to this wrap-up and closure session. This was the very dynamic, interesting, and full of exchange and learning, the 5th Digital Health Society Summit. More than 1,200 people from more than 90 countries have joined us, coming from different domains in digital health. We're very grateful for your time. And if you missed some sessions, they will all be available on the YouTube channel very shortly. We also always promote them on our social media. So please follow us on social media, especially, for example, on LinkedIn. Now, as ECHAlliance or the Digital Health Society, and the same for the YouTube channel. Just click there, subscribe, and you will get a notification when the videos are published. So my role is now to wrap up, given for the sake of time, and also there will be further follow-ups and some articles written on that. I will try to be very brief. Yesterday, Bledin gave us 5 key takeaways from the day 1, and I will try to give 5 takeaways both from day 2 and from the whole summit. But some things that we definitely learned the information of is that digital health is health. It should be treated as a part of the integral part of the healthcare system, not a side story. And in that sense, we need to make sure that it is integrated within the different processes, financing models, and other aspects of the healthcare system, so that we all citizens, healthcare professionals, policymakers, and tech developers can really benefit from this whole transformation that is happening, and that we really can benefit from the richness of data for better prevention, diagnosis, and treatment. So yesterday at one of the sessions, it was said that there are countries that are rich in data, but poor in technology, or rich in data, but still the healthcare outcomes don't reflect this richness of data. For sure, we also, for that, we heard collaboration. So we need better public-private partnerships model, updated public-private partnerships model for health data sharing, for not only for tenders and reimbursement models for health data sharing. It was also, even at the first session yesterday, said who pays for data, how is it reimbursed, what are the incentives, and so on. So we also heard trust. We need to ensure that citizens have trust. But when I'm thinking about this also in relation to all the discussions we had about the need of the whole of systems transformation, this trust is not an abstract thing. It's not something you can teach citizens, teach patients to trust. We need to, as the healthcare providers, policymakers, developers, we need to ensure that our processes that are, I think someone said today, bureaucratized and are actually effective and beneficial for the patients. Only then the patients can trust that their data being shared is actually benefiting them, and then it's safe and secure. So we cannot allow ourselves for any mismatch in the communication here. So we need to promote the benefits, but we also have to ensure that the patients have all those benefits. We learned about those reimbursement models from Germany and France, and also there was a strong advocacy for the integrated European model. So we start from here, but of course with all the development and the European health data space and the European Health Union. And well, there was also a lot of talk about the learning curve and about scalability. So we need to, on one hand, we need to accept that we need time for learning and uptaking and scaling, but at the same time, we should also act quickly without losing this time, because well, we need those solutions being implemented. And Rachel Danscombe today said that we're now in cognitive age. We must work out how to leverage AI for human benefit and how to govern it all. And I will only say that maybe not only leverage AI, but the learning from the whole summit is, of course, the leveraging the health data for human benefit. But of course, we have to solve the issue how to govern it all. That would be from me. I hope you learned something as well. Great 2 days, and we invite you again to follow us on social media, to follow us on YouTube, but also to join our upcoming events. And the next one is, as our colleagues already said today, the Digital Health and Wellness Summit in Barcelona in February. But for those based in Europe or willing to travel to Europe, and also the VIVE in Los Angeles at the same time, the end of February. Yeah, for those based in Northern America or willing to choose the California sunshine over the winter in Barcelona. So thank you all on my behalf, and Bled and Reese, who has co-programmed and co-hosted this event with me.